You're watching News 10 ABC at 9 a.m.
Welcome back, everyone. State leaders warning about a new electronic cigarette. It's called Elf Bar. It's a disposable vape pen that's being advertised all over TikTok and Instagram. Just last week, Senate Majority Leader Chuck Schumer was calling for the government to step in.
Calling on the FDA to investigate Elf Bar, its covert use of social media, and its attempts to slide right into the void after federal action was taken against Juul.
And these Elf Bars, they come in flavors like cotton candy, watermelon. Disposable vape pens like this are all the rage for high schoolers and middle schoolers right now, and the trend is really impacting their health. So we brought in the Director of Respiratory Services at St. Peter's Health Partner, Brandi Ewing, to answer some of our questions. Thanks for coming here, Brandi.
Absolutely. Thank you very much.
So let's start off with, we're talking about these Elf Bars. They're the most popular for kids and middle schoolers, these disposable pens. What are you seeing out in the community?
So what I'm seeing out in the community is, as you said, a trend of middle schoolers and high schoolers who think that it's a great, cool option, that it's not creating the smell and the taste and things like that that cigarettes do, but it really is not without dangers.
And we're talking high numbers. I mean, the latest report from 2021 is 11.3% of high schoolers are vaping and 2.8% of middle schoolers. That's really young.
Yep, and even just in the past couple of years, the statistics show that the increase is about 1,000% in high schoolers who have started vaping who didn't previously, and it's just so alarming.
And the interesting thing is, and you've been working since this first started coming on the scene. So first e-cigarettes were really advertised as a healthier alternative for cigarette smokers. They were saying, oh, this is a better option for you.
Right.
So I ended up getting a question from one of our viewers asking, is it actually healthier to smoke an e-cigarette?
Yes and no. You know, regular standard cigarettes with the tobacco and everything, they have over 7,000 different substances and chemicals in it. And in theory, an e-cigarette has less, but there are so many substances that are in it, you know, derivatives of antifreeze and all sorts of irritants and things like that. So some people think that it's healthier, but it's not without risk.
And we know, too, we don't have that long-term data just yet because it hasn't been on the scene yet. We don't know what it's going to do to people in 50 years, 70 years from now, but we do know it's impacting people's lungs. How so?
So what's happening is that there are people who are getting a variety of different lung conditions. So the chemicals and things that are in e-cigarettes, they are irritants, and then they can also cause damage inside your lungs itself. So there's a condition where it damages the bronchioles. There's also instances where we've had patients who have had weird pneumonias, lipoid pneumonias and things like that. And it's just, you know, things that we didn't see many years ago. And it kind of really gives you a pause and like, something's not quite right here.
And you told me a little bit about this, Brandi, that there are two different types of these e-cigarettes. There are the ones that we can buy from a regular store, FDA approved, but then there are ones that are on the streets. People are picking them up. What's the difference when it comes to toxin levels there?
A lot of it is just really unknown. You know, one pack or a pod of an e-cigarette can be as much as smoking 20 standard tobacco cigarettes. There's all of the different chemicals in it, and then if you get something that is not properly manufactured, it could have any number of things in it, and you're taking that into your body and your lungs, and it can create all sorts of problems with your heart and your lungs and everything else.
And you know, you're out there in the community, you're seeing the health impacts in real life. What do you think was the moment for you that you said, oh, this is going to be a problem on the kids here in the Capital Region?
So it was funny, the other day I was driving around in the Capital Region and I saw the wonderful billboard that was done as a project by a high school student from, I believe it was Colony High School, as part of their graphic design thing. And I was like, wow, this is amazing that, you know, a high school student, you know, decided to do as their project, putting up this bulletin board here. And I had done some research about it a little bit and found that it was a bulletin board that's going to be going around the Capital District. And the bulletin board is really very simple. It just says, you know, that when you're young, you don't want to get popcorn lung. But I thought to myself, well, isn't this interesting? Like 20, 30 years ago in respiratory school, that was like a 5-second conversation about this disease, popcorn lung, bronchiolitis obliterans. And now here we are, it's up on a bulletin board, you know, so it's crazy.
and we're seeing so much of this impact. What is this last, thing you want to tell parents, grandparents out there, your last message for them?
Just because it's available does not mean that it's safe. You really have to do your homework to make sure that you understand what you're taking into your body.
Thank you so much for joining us, Brandi.
Absolutely.
Really appreciate it.
Thank you so much.
It's 9:28 right now. We're going to be right back with another look at that forecast and more news.